Part C, developed by Let's Update Language Academy. This audio is copyrighted. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a presentation by a tissue viability nurse called Claire Harris, who's talking about her work with ulcer patients. You now have 90 seconds to read questions 31 to 36.
Hello, my name is Claire Harris and I am a dedicated tissue viability nurse with years of experience in caring for elderly patients. Today, I want to share some valuable insights and challenges we face in providing optimal skin and wound care for this vulnerable group of age-old patients. I took this area of specialization for enormous reasons. We found that ulcers are quite common in older adults and tend to recur frequently, making it difficult to predict and manage. On the other hand, people infected elevated. So, I have decided this is not a neglected category, rather this deserves a better standards of life, and it's high time to deal with this. We've learned lessons and we employed the strategies to enhance their life. As individuals age, their skin becomes increasingly fragile and more prone to injuries and wounds. This is particularly challenging for elderly patients. In this category, they often have multiple comorbidity. Meanwhile, one of the main reasons for skin breakdown in elderly patients is prolonged immobility, which can lead to pressure ulcers. These patients often require comprehensive and multifaceted care. Moreover, adherence to the measures taken from the clinical side is essential. It isn't a serious issue, but it should be highlighted since it's troubling for the caregivers. Our approach to care involves a number of roles such as thorough assessments to identify risk factors and early signs of skin damage. We utilize a variety of interventions, such as repositioning schedules, specialized mattresses, and advanced wound dressings, to prevent and treat wounds effectively. Along with this, giving awareness and enlightening is pivotal for us, but difficult at the same time. However, we can't move back, as it makes the base. We try to teach patients and caregivers about proper skincare techniques and the importance of nutrition and hydration in maintaining skin integrity. One of the challenges we face is the complexity of the conditions that our elderly patients present with delay the healing. For example, patients with diabetes may have neuropathy, and it is common that it affects their ability to feel pain and recognize the early signs of a wound. Additionally, the social and emotional aspects of wound care cannot be overlooked since it's atypical. Many elderly patients may feel isolated or depressed due to their condition, which too can impede the healing process. Let's update Language Academy. Despite these challenges, there have been many success stories that highlight the impact of effective wound care that brought down the proportion of infected patients. For instance, advanced therapies like negative pressure wound therapy, hyperbaric oxygen therapy were introduced and used when it is absolutely necessary, and interdisciplinary collaboration was promoted. But all these were made to execute a single wound care protocol in our facility. This has significantly reduced the incidence of pressure ulcers among our patients. Additionally, our patient education programs have empowered my elderly individuals to take better care of their skin, leading to improved outcomes. One particular case that stands out is that of an elderly gentleman who had been struggling with a non-healing leg ulcer for several months. Through a combination of advanced wound dressings, proper nutrition, and patient education, we were able to completely heal his wound outside. Though it boosted his morale, while talking in person, I understood his overthoughts about recurrence. It took a while to relive from this. By focusing on comprehensive care and patient education, we strive to improve the quality of life for our elderly patients. Our goal is to prevent skin breakdown, promote healing, and support our patients in maintaining their independence for as long as possible.